Nursing is a critical healthcare field, with over 3 million professionals in the U.S. It combines the art of compassionate care with the science of healthcare. As a dynamic profession, nursing continuously evolves to meet society's changing needs. Nurses play a vital role in protecting and optimizing the health of individuals and communities. The warm, professional atmosphere depicted in the image reflects the caring, skilled nature of nursing. Nursing is a multifaceted profession that seamlessly blends the art and science of caring. Nurses play a crucial role in protecting health through preventive measures and vigilant monitoring. The nursing profession is dedicated to facilitating recovery and alleviating suffering in all its forms. Nurses work to integrate the various aspects of care into a unified and cohesive practice. Nursing requires both technical expertise and a deep compassion for those in their care. Nursing is a vital profession that has been defined by leading professional organizations around the world. The American Nurses Association defines nursing as the diagnosis and treatment of human responses. The World Health Organization defines nursing as autonomous and collaborative care of all individuals. The Royal College of Nursing defines nursing as the use of clinical judgment to improve health. These definitions highlight the diverse roles and responsibilities of nurses in providing comprehensive, patient-centered care. Nurses are autonomous healthcare providers who work collaboratively with other professionals to address the physical, emotional, and social needs of their patients. Nursing practice is grounded in clinical expertise, critical thinking, and a deep commitment to improving health outcomes. Nursing is a unique profession that combines the art of compassionate care with the science of evidence-based practice. On the art side, nurses provide a comforting presence for patients during vulnerable moments, using intuition and empathy to understand their unspoken needs and concerns, and building therapeutic relationships. On the science side, nurses rely on their clinical expertise developed through education and experience, applying analytical thinking to complex health problems, and grounding their practice in the latest research. This dual nature of nursing, the art and the science, is what makes it such a rewarding and impactful field. As you can see, nurses must balance these two critical aspects of their role to deliver the highest quality of care. The core values of the nursing profession are the fundamental principles that guide the actions and behaviors of nurses. Advocacy: nurses stand up for their patients' rights and needs, ensuring their voices are heard and their best interests are protected. Compassion: nurses deliver care with empathy and understanding, showing genuine concern for the well-being of their patients. Ethics: nurses make decisions based on strong moral principles, upholding the highest standards of professional conduct. Respect: nurses honor the individuality and cultural differences of their patients, treating everyone with dignity. Learning: nurses are committed to continuous professional development, constantly expanding their knowledge and skills to provide the best possible care. The nursing process is a systematic approach to patient care that involves 5 key steps. Assessment: gathering comprehensive data about the patient through observation and interaction. Diagnosis: identifying the patient's problems and needs based on clinical judgment. Planning: developing strategies and interventions to address the patient's needs. Implementation: carrying out the planned nursing interventions with skill and compassion. Evaluation: determining the effectiveness of the care and adjusting as needed. Nursing practice encompasses a wide scope, from the beginning of life at birth to caring for individuals and populations across diverse settings. Nurses work in a variety of environments, from hospitals to people's homes, providing care at multiple levels for individuals, families, and entire communities. The nursing approach is holistic, addressing not just physical needs but also emotional, mental, and spiritual aspects of health and well-being. Nursing is a multifaceted profession with diverse responsibilities beyond just providing bedside care. Nurses play a critical role in directly caring for patients, monitoring their condition, administering medications, and performing procedures. Educating patients and families about their health conditions and self-care is a key nursing responsibility. This empowers patients to better manage their own health. Nurses coordinate complex care plans across multiple healthcare providers to ensure continuity throughout the patient's journey. Nursing advocacy involves standing up for patient needs and influencing healthcare policies to give voice to vulnerable populations. Nurses play a critical role in healthcare teams, collaborating with physicians, therapists, and other specialists to provide comprehensive patient care. As the glue in the patient care journey, nurses serve as the connection, bridging information gaps between patients and other providers. Nurses' constant communication with patients and providers is essential for ensuring continuity of care, as they maintain a 24/7 presence in most healthcare settings. The diverse skills and expertise of the healthcare team, with nurses at the center, create a collaborative atmosphere that benefits patient outcomes. Nursing is a diverse field with many specialized areas of practice. I'll be covering 4 main categories of nursing specialties today. Hospital-based roles like medical, surgical, critical care, and emergency nursing. Population-focused roles like pediatric, geriatric, and public health nursing. Advanced practice roles like nurse practitioners and nurse anesthetists. Emerging specialties like informatics, genetics, and telehealth nursing. Each of these areas requires specialized knowledge and skills to provide excellent patient care. I'll go into more detail on the key responsibilities and settings for each specialty. Understanding the breadth of nursing specialties is important for anyone considering a career in this field. Nursing is a dynamic field with various educational pathways to consider. We'll explore the different entry-level programs, bachelor's degrees, and advanced degrees in nursing. At the entry level, students can pursue licensed practical, vocational nursing or an associate degree in nursing, ADN. For a bachelor's degree, the options are a Bachelor of Science in Nursing, BSN, or an RN to BSN bridge program for existing registered nurses. Advanced degrees include the Master of Science in Nursing, MSN, and doctoral programs like the Doctor of Nursing Practice, DNP, or PhD. Each pathway offers unique opportunities and prepares nurses for different roles and responsibilities within the healthcare system. The choice of educational path depends on the individual's career goals and aspirations. Nurses provide a holistic approach to patient care. Looking at the whole person beyond just medical treatment, their continuous presence throughout a patient's healthcare journey allows them to combine technical expertise with compassionate advocacy. Nurses act as advocates, working closely with the healthcare team to ensure the patient's needs and preferences are heard and addressed. Nurses also play an important role in educating patients and communities on prevention and wellness, going beyond just treating illness. Staffing shortages in nursing lead to higher workloads for nurses, which can negatively impact patient care and contribute to burnout. Recruitment initiatives like offering competitive pay, benefits, and career development opportunities can help address staffing challenges. Patients today often have more complex medical needs, requiring nurses to have specialized knowledge and skills to provide high-quality care. Ongoing training and education programs can equip nurses to better manage the demands of caring for complex patients. New technologies are constantly being introduced in healthcare, creating learning curves for nurses who must adapt to these changes. Providing nurses with ample opportunities for technology training and support can help them navigate these transitions more effectively. Burnout is a major issue in nursing, leading to high staff turnover rates that further exacerbate staffing shortages. Implementing comprehensive wellness programs that address nurses' physical, mental, and emotional needs can help reduce burnout and improve retention. The nursing profession is evolving, with nurses taking on greater responsibilities in primary care settings, such as leading clinics and managing patient care. Advancements in technology are also transforming nursing, with the growing importance of informatics and digital health tools to support patient data management and care delivery. Telehealth is a rapidly expanding area, allowing nurses to provide remote care and consultations, improving access to nursing expertise, especially in underserved areas. These trends reflect the increasing scope and influence of the nursing profession in shaping the future of healthcare. Nursing is the backbone of healthcare, with over 3 million dedicated professionals in the U.S. Nurses provide constant, around-the-clock care in healthcare settings, offering an unwavering presence for patients. Nurses are consistently rated as the most trusted profession, reflecting the vital role they play in delivering compassionate, high-quality care. Nurses are the heart of healthcare, representing a massive workforce that is essential to the well-being of individuals and communities.